The Politicrat Daily Podcast is now on Pandora. It's great to be part of the Pandora family. You can listen to this podcast right now on Pandora or wherever you get your podcasts. So please subscribe and thank you for your support. Welcome to the Politicrat. I'm Omar Moore. It is Monday, December the 28th, 2020.
Many times they pass away and no family members at the bedside. And of course, we have to do this for public health concerns and preventing the spread. But it's really sad that this moment, that when your life comes to completion, it's done in a way that no one would want for themselves. There's absolutely nobody who would want to die alone of COVID-19 in a hospital by themselves, surrounded by people in gowns and gloves who do not know them personally. There's no one who wants that for themselves, but that's the way it's had to be for a long time, unfortunately. And that's challenging to see on a daily basis.
On this episode of The Politicrat, a conversation with Dr. Taison Bell. He is the critical care and infectious disease physician at the University of Virginia Health in Charlottesville, Virginia. We will be covering a lot of bases in this conversation. And that conversation begins right after this. With me right now on the Politicrat Daily Podcast is Dr. Taison Bell. He is the critical care and infectious disease physician at the University of Virginia Health at Charlottesville. It's just a real honor to have him on. He's somebody who is somewhat a movie star. He was in a documentary called Totally Under Control, directed by Alex Gibney, who I've spoken to on this podcast earlier this month. Dr. Bell also recently got a shot of the brand new vaccine. I'll be talking to him about that as well, and a number of other very important issues. Dr. Bell, thank you very much for being here today on the Politicrat podcast.
Thank you. It's a pleasure being here with you.
I want to first start off by asking you about the profession and how you ventured into the profession before we get into some of the other things.
You mean medicine in general?
Yes, sir.
Yeah. So interesting story, because I think my journey to medicine began at a young age. I was a sick child with asthma that was severe enough that I was hospitalized a couple of times, went to emergency room a handful of times as well. And I received immunotherapy, which were shots to try to decrease your immune response to some of these allergens. And because of that, I had a lot of exposure to my pediatrician office where I was receiving these vaccines, or not vaccines. I'm so used to saying that now, but these injections. And at some point, I was actually going on a weekly basis, and sometimes a couple of times a week, just to get this therapy. And the notion of being around healthcare workers and working in healthcare became kind of normalized to me in that process. I grew up in a very underserved community where there weren't a lot of examples of people who had gone through college, much less gone to medical school or dental school or architects or engineers. That just wasn't my reality. And so I think that for a lot of kids who grow up with privilege, the concept of success becomes normalized. You know, this is something that you walk into rather than you strive for. And I think for me, seeing physicians and nurses and being in a healthcare setting so frequently normalized that career track for me as well. I was fairly early on when I told them that I wanted to be a physician when I grew up. I was probably about 6 or 7 years old. And they fed that dream for me. They addressed me as Dr. Bell from that point forward. So whenever I came to visit and get an injection, they called me Dr. Bell. They didn't call me Taison. And they let me walk around with some of the nurses who were giving in shots and vaccines to some of the other children. And my role was kind of to calm them down and talk about why it was good to receive the shot. And they even purchased a little white coat for me when I came to visit the office. So in my mind, I've been Dr. Bell for a long time. And this dream of becoming a physician, though it was definitely a struggle, it seemed more of a normal thing that I could do because I saw so many people, even though they didn't look like me, they cared, and I was able to see them as regular people.
Did you watch any of the television shows that talked about doctors? I mean, St. Elsewhere or any of these shows. Did you ever watch any of that kind of thing? Because myself as a lawyer, I actually used to watch I know, of course, there's a lot of difference between the shows and real life. You find that out. But I used to watch a lot of these lawyer shows, and I don't know if that was the same for you as a doctor or wanting to, as you were in your journey to become one.
Yeah, well, ER was my big show when I watched growing up, and I remember Eric LaSalle, the opening credits. He does that like karate chop move. That was it for me. That was probably the first one that I saw that I kind of latched onto, and I think with a lot of people, Grey's Anatomy was one of the others. But over the years, there have been so many, I've lost track at this point. And actually, documentaries were something I grabbed onto as well. So there were a few documentaries that profiled doctors who were working in hospitals and or traveling overseas to deliver healthcare. I forgot the names of them, but I would find them on like National Geographic and the Discovery Channel. And I like those because they weren't dramatized. They were following around real physicians and kind of, you know, they were spotlighting specific sorts of moments that were high drama. But this seemed to me more like a realistic picture of what I might be doing later in life.
Absolutely. I wanted to then ask you about, your journey now. You're a critical care and infectious disease physician at UVA Health. Um, we're at the end of 2020 now, and you've seen so much. Um, can I start by at least asking you about what it's been like for you? I know you do talk about this in the documentary Totally Under Control. But Dr. Bell, what has it been like for you? I mean, have you just being in this environment where you're constantly seeing people who don't survive this virus because it's so deadly, and you've been let down by government in so many profound ways, and there's a system that continues to attack Black people relentlessly, hundreds of years of this. Um, and then here you are as a doctor in the middle of all of this, and you're trying to help people. You help people, and then there are people that aren't so fortunate. Can you talk about your journey through this year has been so difficult, I'm sure, for you too.
Yeah, it has been very difficult, and it's hard to really put it in words how to capture what you're feeling, but it does feel like hell. And the thing that's different about this pandemic, because what I will say is that COVID-19 is really a symptom of an underlying disease that I'll call structural racism. There are so many different ways that Black people have worse outcomes compared to white counterparts or any other race in this country. And a lot of it relates to how society was set up, how neighborhoods were set up, and financing and unequal distribution of healthcare, inadequate access to resources, inadequate access to education. This all leads to disproportionate outcomes. So, for instance, influenza, which we're in the midst of influenza season now, this is a disease that also adversely impacts African Americans, both in testing and by outcomes. So this is really a new chapter or a new sun or a new day, but the same sun in a sense. But what's been so different about this, Omar, is that in my normal work life, I can show up in the hospital, deliver care that I hope is high quality, and make an impact on people. We certainly can't save everyone's life, but we can make some progress. And if it is someone's time to pass away, we can make that experience as comfortable and pain-free as possible. But what this pandemic has done has destroyed the social ties that bond us. And so you realize how much medicine is delivered outside of what we traditionally call medicine. And what I mean by that is uh, there are plenty of medications I will prescribe on a daily basis, and things I might change the levels or start new medications, and difficult conversations I might have. But if there's a family member at the bedside, a daughter, a son, an uncle, a parent, someone who's known that patient for their whole lives, there's a medicine that they deliver to that patient that we can't give. You know, the comfort of having someone who's a familiar face, who loves you, who knew you before this and can kind of walk you through it. It gives people inspiration and hope. And it at least makes a terrible situation a little bit better. And because of the pandemic, that's been destroyed. So our patients suffer alone. We're there with them, but we're trying to do video chat with their family members and have difficult conversations. And many times they pass away and no family members at the bedside. And of course, we have to do this for public health concerns and preventing the spread. But it's really sad that this moment, that when your life comes to completion, it's done in a way that no one would want for themselves. There's absolutely nobody who would want to die alone of COVID-19 in a hospital by themselves, surrounded by people in gowns and gloves who do not know them personally. There's no one who wants that for themselves, but that's the way it's had to be for a long time, unfortunately. And that's challenging to see on a daily basis. And then you touched on this, but the impact that it's had on my community, the African American community, is heartbreaking, really. And again, like I said, this is a new chapter in the same book, but when you see it so aggressively attacking and killing members of your community, it becomes very personal. And it's one thing to see it in the hospital and be able to come home and kind of and have that escape. But when you come home, you touch base with your family members who may have COVID-19, or your friends and family and colleagues who have COVID-19, or you're talking to someone who's hesitant about getting the vaccination. You can't escape it. And in some form or fashion, COVID-19 has been a part of my life as much as oxygen, almost, that I talk about this all the time. And of course, I don't mind it because I do have a role in this, but it is difficult to be dealing with something professionally and personally and being stretched in both ways, very thin. It's been very difficult, but I think that, I've received the vaccination almost 2 weeks ago, and that gives a measure of hope and seeing the light at the end of the tunnel. Even though you know that there's more darkness to get through, seeing it there is something that we haven't had since the beginning of this pandemic. And now that it's here, we have something that we can strive towards.
And you've talked about the vaccine. I was going to ask you about this because you're profiled in the New York Times recently, just a couple of days ago now, or if not very, very recently anyway, that you had this vaccine shot. I believe it was the Pfizer vaccine, if I remember correctly.
That's right.
How is it going? How are you feeling? Any side effects? Can you just talk about that for a few moments?
Sure. So like any injection I've ever received, I did have a little bit of pain at the site, and that immediate pain went away. The next day, I did have some soreness in the arm, and that had commonly been reported as well. It wasn't much different than the soreness I received after getting the influenza vaccination, for example. So I didn't really notice it. And then that second day in the evening, I didn't have chills or a fever or anything like that, but I did notice that I felt a little colder than usual, and I had on an extra layer than I normally have around the house, and temperature was the same and everything. But my wife noticed it and was like, "Are you doing okay?" And I was like, "I'm fine. I just feel a little cold." But that lasted just one evening, and then on day 3, I felt completely back to normal, just fine. Most of my colleagues have had the same sort of experience with just a little bit of arm soreness. I have had a couple who have had some fevers and sometimes chills. In all instances, it's lasted 1 or 2 days and completely went away by a couple of days.
Now, you've just described your experience with the vaccine. As you know, and I did point to this earlier, there has been centuries of government and private experimentation on Black people, Black women, Black men. There are extensive books written about this, documentation about this for centuries, where Black people have been experimented on and desecrated in the most graphic and brutal ways. And I think for people listening to this, there's several books I would recommend. One of them is written by Harriet Washington. I believe it's called Medical Apartheid. I strongly recommend that book for people. It's just one of the many that go into this in some really graphic but very important detail that you need to know. With that backdrop set, Dr. Bell, the African community, the Black community, African American community, Black community in general and at large, you would obviously agree that there'd be understandable skepticism amongst cross sections of that community regarding getting this vaccine that you have just had. Can you talk to people who are listening, who may be part of that community, who are skeptical, who are actually going, I don't know about this, given the government history of experimentation on Black people for so long?
I really like that you used the word understandable skepticism, because I think the first thing to really discuss is that it's understandable to have misgivings or hesitancy or whatever you want to call it to receiving a vaccine. I think it's normal to be skeptical or have questions about something that's being injected into your body, especially if it's something that did not exist at this time last year. And especially if you're part of a community that has heard stories like this before, where the intent was nefarious and there was neglect. So I think, the first thing that we should do is not ridicule or malign people who have these feelings, right? These are normal. And what I try to explain to people who work with me, residents, fellows, my nurse practitioners, is that when you see someone from the Black community who does not trust what you're saying, you have to realize that it may not be that they distrust you, but they distrust the system. And unfortunately, it's an earned distrust. There are several examples where the government, the medical establishments, academic medicine have done wrong, illegal, and unethical things to the Black community. We've worked hard to earn the distrust of the Black community, and addressing that head on is really the first step when it comes to that. So we can't just approach it with, oh, this time is different, because we've heard that before. And we can't just say, well, that was a different time, because there have been different times before. I think what we have to embark on is an aggressive campaign to vaccinate a large segment of the population, but we also have to be very open and transparent about how the vaccine got here, what's gone into it, and what we expect the side effects will be. We need to have a very honest conversation about what we know and what we don't know, because when we just talk about what we know, we seem arrogant. And there's a lot of uncertainty that still remains in the vaccine, not in terms of how effective it'll be for preventing people from getting severe COVID-19, but there are a lot of questions like, what could potentially be the effects on childbearing, lactation, fetal development. We don't think there'll be any adverse events, but we have to do the studies. Long-term immunity, we don't know how long that will particularly last. And whether it will prevent the spread of COVID-19 as opposed to just preventing you from getting sick. We have to be honest about what we know and don't know about it. So what I tell people is actually, let's backtrack. First, I just listen. I think that's the important thing to do first. If someone does not want to take the vaccine at this point, I want to find out why. I don't want to assume that because they're Black, they mistrust the medical community. It might just be they have misinformation. For instance, half of African Americans who at this point in a poll from Pfizer, half of Black Americans who say they aren't going to take the vaccine believe that they'll actually get COVID-19 from the vaccine itself, which is not true because it does not contain any element of COVID-19 or does not contain the coronavirus itself. So we have to correct information gaps like that. And that sort of person, you may not even have to dig deeper than that and just give accurate information. But there's always an underlying reason why someone may not want to take the vaccine. So a lot of what I've received is, well, it's only been a year. So how can I trust something that has been rushed to market like this? And I think for those people to explain the timeline and really say that the timeline began back in 1989 for these vaccines, because the first paper was published back then, and they've been working on this messenger RNA technology since then. The last sort of leap that they needed to make was how to deliver it in a vehicle that kept it stable in the body long enough to be taken up by your cells and made into the protein that your immune system makes a response to. So it really wasn't that we started de novo at the beginning of the pandemic. We just had this technology that years and years of research that went into, and the government funding of $10 billion, which, many things could accelerate if we had $10 billion of funding. But we were able to accelerate that from the beginning. And then the clinical trials were able to be set up very quickly because there was international cooperation between the drug companies and the governments and regulatory agencies. And unfortunately, because the pandemic was worsening, the trials got to completion relatively quickly just because more people were getting infected. And then distribution was able to be accelerated because manufacturing began in concert with the clinical trials. So instead of trial completing and then you manufacture the doses, you actually had doses being manufactured while the trials were going on. So we were able to compress that timeline, but the regulatory agencies, the oversight that ensured the safety and efficacy and scientific integrity all remained intact. So for instance, the oversight committees that oversaw the clinical trials, they have the full authority to shut it down if people are being taken advantage of, or it seems that that is unsafe. And that never happened, but that governing body was there. The advisory committee to the FDA that approves the emergency use authorization, or they recommend approval for emergency use authorization, that remained intact. And these are independent experts from around the world who they're not on a government payroll. They don't have an interest in making something rushed to market that's unsafe. And then third is the ACIP, which is the body house and the CDC of independent experts that advise the CDC on how to implement new drugs and therapeutics. Another independent agency, no skin in the game, who maintain that body of oversight. And the other thing to point out is that we actually have more data at this point for this vaccine than we usually have for any other vaccine. Most vaccine trials are maybe 3,000 up to 6,000, maybe at the most, before they get approved. We've got over 75,000 people who've been studied at this point. So we have a lot more data to back up this vaccine than we usually do because of urgency and because of the timeline. But I have no doubt that the two available at this point, Moderna and Pfizer, are both safe and effective vaccines. I think it's a remarkable accomplishment. I think what's lost in this conversation is that it's pretty remarkable that we were able to produce these. 95% effective rate is better than anyone would have hoped for. And so it makes it one of the most successful vaccines in history. And we still need to learn more about it as far as how effective it is, as far as asymptomatic spread and having disease. But this is a big win. So I think the example I gave of receiving the vaccine and posting it and talking about it and sharing my experience, and other physicians who have done this as well. There's a prominent Black men in medicine group that's doing the same. I think, things like this will help, but ultimately the Black community is not monolithic. We all have different walks of life. We come from different areas. We have different thoughts and opinions. And so there's not going to be like a cookbook or a checklist of this is how you engage Black people. It really is, you understand the issues, you listen more than you talk, and then you go through what the community that you're in front of, what their specific concerns are. So I think we have to recognize that there's the diversity of approaches we need to take, and we need to take all of them. But the fundamental, foundation of our engagement needs to be respect and attention to the concerns that the African American community has had.
And just a few more things on the back of what you've just said, Dr. Bell. Yes, the understandable skepticism, as I've outlined, amongst many in the Black community around vaccinations, and also the idea that seeing politicians, mostly white politicians so far, who have had this vaccine, whether that's going to sway people in our communities or not in any appreciable way. And then on top of that, a very important issue, cost. The notion that this vaccine, Dr. Bell, is going to be free of charge. I think people listening to this should really put that thought out of mind. And I don't necessarily think that lots of people listening would think that they are going to get this for free, but there's going to be a cost for this. And that's what I'm concerned about. Can you talk me off a ledge? If I'm the average person, I am the average person. But if I'm anybody who is ready to get this vaccine, as I personally am, when that time comes, Dr. Bell, I'm looking at a hefty medical bill for this. And I have insurance. Now, there are lots of people who do not. But I'm still looking, people are going to be looking at a bill for this, aren't they not?
Sure. The federal government has committed to making this cost-free. One thing that we have to keep in mind is that there can be different costs associated with a medical visit that you receive. So for instance, we also said that COVID-19 testing would be free. And there are some instances where people got tested, but were seen for other reasons or tested for other things, and they may have not necessarily been covered. So we have to make sure that there are no donut holes like this that people can fall into and still receive a bill. So, for instance, we need a firm CPT code when a CPT code is a procedure code that physicians use to reimburse for services. There's one for the COVID-19 vaccination that's a standalone and makes it an easy mechanism to reimburse. The federal government can reimburse. I think, this is also an instance where using your representatives, if something were to happen and you were to get charged for a bill, is something that needs to be escalated, because I think we need to know these instances. I do have trust that the federal government took a commitment to making sure that this is cost-free will hold. Does that mean it's going to work 100% of the time? I don't think so, because we have a complex healthcare system. But when they do happen, we just need to make sure that we have, like a SWAT team come in and fix it and make sure that there's absolutely no cost. Of course, it's in our interest to make this free, because we don't want any barrier to receiving this vaccine. We want it to be easy to get it. So in other words, we want it to be a downhill process instead of an uphill process. So any concern about cost needs to be removed from it. So I have faith that the effort is there, the will is there. We just have to make sure that we don't have any holes in the ship, and that we can patch them up quickly if they do arise.
Two last things. One, politicians and responsibility. I looked at
Marco Rubio.
Yeah, there you go. I will let you take it from here, Dr. Bell.
What am I allowed to say on that? Can I?
Anything. You can curse if you wish to, by the way.
Yeah, I thought it was a bunch of bullshit, to be honest. I think that as a politician, you may have views that intersect with others, or that don't agree with others, or even run against opinion of science or religion or what have you. But you're a representative of the people. And so what you have to do is put yourself aside in these instances and speak for the people. And for the people of Florida who are experiencing high rates of COVID-19, hospitals that are overrun, people that are dying, Florida's an older community compared to a lot of other areas of the country as well. You have a fundamental responsibility to advocate for them. Does advocacy look like tearing down the most respected infectious disease physician and public health official in the whole world. It doesn't look like that. Does advocacy and doing the right thing as a leader mean tearing down the science while skipping to the front of the line to get your vaccination to make sure that you're protected while your people suffer? It doesn't look like that. And does it mean gaslighting people on your very public platform in the face of a pandemic of historic proportions that's killing a record number of people? It doesn't look like that. So it was infuriating to me. I think that he's failed the test as a public leader, as a servant. And it's something that I'm not going to ever forget. I think, we have a long history and memory when it comes to things like this. And later when he tries to backtrack on this or walk away from it or try to rewrite the historical record on his response to the pandemic, we're going to remember this. It's saved in my bookmarks. It's not going away. So I remember that moment because, even now, we're past the initial wave of spring and the initial wave in Florida. We know what the science says. To attack people who are literally trying to save people's lives for your own personal opinion and whatever motive that might be, I have no idea. But he's failed as a leader, as a human being. He's just utterly failed. I'm just going to leave it there.
and I will not add to that either. I think that I would like to end it there, but I just have to ask you because this would not be good if I didn't. Mm-hmm. Doctor, now she shared the last name as I do, so I kind of consider her a part of my own family. Mm-hmm. But all that aside, Dr. Susan Moore.
Yeah.
A lot of people listening may not know of who that is or who that was, I should say. But for the purposes of those listening, Dr. Bell, can you talk about her? Because what a loss.
Yes, Dr. Moore is a family physician in Indiana who was hospitalized with COVID-19 and was not receiving adequate pain control and attention to what she was going through. And she was vocal and advocated for herself and let people know across the globe what was happening. And unfortunately, she died of COVID-19. The episode really highlighted a lot of the problems when it comes to racism in healthcare. One is the lack of attention and concern to African-American patients and what they're experiencing. There's data showing that a good portion of providers believe that African-Americans have different pain receptors and don't experience pain the same way that white people do and don't need as much pain control. Implicit bias in how we perceive African-Americans who are in pain versus white people that are in pain lead to disproportionate pain control scores. So African-Americans who are hospitalized with pain disproportionately have that pain undertreated and end up with worse pain scores compared to white people. And this highlights the fact that we are in an altruistic profession. I have no doubt that her provider believes in equity and adequate access to healthcare and all those. But fundamentally, the provider has blinders on. And those blinders might be your implicit bias or not fundamentally understanding racism in healthcare. There's one point she highlighted the fact that he was trying to send her home. Her physician was trying to send her home and she felt like she wasn't ready to go home. And it was based on oxygen levels. Well, we have research showing that oxygen levels can be overestimated in people of African descent because of the virus skin color. It interferes with the scattering of the light and how it interprets our levels. So it might be 6 points upwards lower than what it actually shows on a monitor. You have to know things like this and be aware of things like this in order to deliver adequate care. But first and foremost, you have to start it with the level of respect. And I think respect is ultimately the medicine that was not given. And she advocated for herself because she knew that her life was at risk and she was dying. And unfortunately, she passed away. what made me so upset was the statement that IU put out, Indiana University, where she passed away, that really just bathed in the racism that she was trying to highlight. They said that they could, as I'm paraphrasing, but that they could understand that some of her providers may have been intimidated by a woman who was knowledgeable about her condition and questioning them. And intimidating Black woman who's educated, informed, and advocating for herself, that is a well-established racial stereotype. And to discount someone after they've died in your hospital and to use racial stereotypes in that dismissal is like a slap in the face. They may as well have gone up to her after she passed away and slapped her in the face with that statement. So it's important to highlight because you have to put stories out there like this, because if you can see that disparities in healthcare can happen to a Black woman who's a physician and a colleague who's advocating for herself and still receive disproportionate care and concern to her condition, it can happen to any Black person. So I fear the moment when I may have to be in a hospital or my family has to be in a hospital, because this is going to be on the back of my mind. There's so many other African-American physicians who have stories of either inadequate pain control, inappropriate respect and concern given to their needs. I have a personal story. It's at some point this has to stop. And the more we talk about it, I believe the better we are for it, because as someone told me, we may have dirty laundry, but it doesn't get clean unless you agitate it. So you've got to get it out there and talk about these issues. So I'm just so sad for her and their family and what they're going through right now. It must be devastating.
Absolutely. And I echo your sentiments. And I also, at this point, also send my publicly just mention this, my deepest and most heartfelt condolences to her family. Really, I read the story about her in the Washington Post, and you've shared that on your Twitter page. And I really do appreciate that you paid tribute to her just now in the way that you did. It's greatly appreciated. And, this is a problem that has been going on for generations here. Dr. Taison Bell, thank you very much, sir, for your time. I really do appreciate it. You are, of course, the critical care and infectious disease physician at the University of Virginia Health in Charlottesville, Virginia. You have some social media that you'd like to share in terms of your Twitter page or anything like that so that we can get that for you?
I think follow me on Twitter. I've been very active trying to engage the community. So that's been my primary platform.
Great. Is it Dr. Taison Bell at Twitter? I forgot what
the
Twitter handle is.
My first name and last name, TAISONBELL.
Dr. Bell, thank you so very much indeed. I really do appreciate your time today. Thank you.
Thank you. It was really nice having a conversation with you.
Likewise. Very special thanks to Dr. Taison Bell. He is the critical care and infectious disease physician at the University of Virginia Health in Charlottesville, Virginia. Really appreciated his time. Dr. Bell will be taking the second shot of the Pfizer vaccine in a couple of weeks' time, and I wish him well. A link to his Twitter page and also a link to a New York Times story that recently profiled him as he took the vaccine will also appear in the liner notes of this episode. And also there will be a link to the story of Dr. Susan Moore. She is the doctor that was a focus of our conversation in this episode. Because of the systemic attacks on her. She is no longer with us. Dr. Susan Moore is yet another example of how a system continues to murder black people with impunity. Whether it's the death penalty and the death of the innocent man, the killing of an innocent man by execution, named Nathaniel Woods earlier this year, or whether it is a situation like this where the medical profession basically murdered Dr. Susan Moore. Black people continue to be murdered by a system, and a system that is not broken, a system that is working very well when it comes to the killings of black people. The system is not broken. It is working very well indeed for those who profiteer off it, who create it, and who orchestrate it. White men have been doing this for many centuries. And black people are paying the price in unprecedented numbers. To the family of Dr. Susan Moore, who is just 52 years old, I send my deepest, most heartfelt condolences. And I am very sorry for your loss. May Dr. Susan Moore rest in power. Thank you very much for listening to this edition of The Politicrat. I'm Omar Moore.